Hello viewers, in today's video I will be joined by Dr. Mainak Maitra. He is an eminent E.N.T surgeon from India and I believe he is the next big thing when it comes to E.N.T worldwide. In today's video, Dr. Mainak will be sharing his insight regarding how to do exceedingly well in the university exams of E.N.T at the end of post-graduation in E.N.T from an Indian university. He will be sharing the time one needs to devote. He will be sharing some tips and he will be sharing the strategy and the material one needs to study to do exceedingly well in the university exams at the end of post-graduation. A few days back, I had shared my own insight regarding the same topic, and you can find the video in the description below. Do check that video out as well, but please don't miss this video because Dr. Mainak Maitra's insight is of immense help, not just to me, but also to everyone who is interested in doing well in post-graduation, because he has not only personal experience of doing well, but he has guided several batches of postgraduate students over the years. So without further ado, let's welcome Dr. Mainak Maitra to this YouTube channel for the third time. His previous two visits were highly well received and he shared very interesting insight. He talked about cochlear implant in his first visit on this channel, and in the second visit he talked about how to approach presentations during conferences in E.N.T. So let's welcome Dr. Mainak Maitra back to this channel for the third time. So the genesis of this video was just a comment on my YouTube channel where one person had asked me to share my opinion regarding how to do well in the postgraduate university exams at the end of MSc from an Indian university. I had shared my opinion, and in this video I will be happy to announce that perhaps the best voice in this regard has decided to join us to share his opinion, his insight regarding how to do well in the university exams at the end of post-graduation in E.N.T from an Indian university. Welcome to this channel for the third time, Dr. Mainak Maitra. How are you doing?
Thank you, Dr. Puspen. A very good Sunday morning. Glad that you have selected this kind of a date where we both are a bit relaxed, just having a normal conversation over a cup of tea on a Sunday morning.
That is true. Thank you for joining us. So we'll jump right into the topic. Let's start with what material, what books would you recommend postgraduate students to read in order to do well in the postgraduate exams?
Well, the first thing which I should be telling my juniors or any postgraduate resident is that in postgraduate training, no single book is a complete book. Okay. So first of all, which is a must, which people often ignore, is an undergraduate textbook. As I told in one of our previous videos that when a person starts his postgraduate residency, the undergraduate E.N.T textbook must be completed within the first 6 months, so that the basics are absolutely brushed up. And when you go on, because what we must remember is the undergraduate or postgraduate, the E.N.T of postgraduate level is a huge jump from the E.N.T of undergraduate level, and unless one's basics are absolutely fine, he or she will have problems in understanding the concepts at the postgraduate level. So yes, first is an undergraduate textbook, which is of utmost importance, whichever textbook he or she is comfortable in. And now coming to the postgraduate level, there are two kinds of books which are available in postgraduate level at the level of E.N.T, in the subject of E.N.T. One is a textbook of otorhinolaryngology. The complete E.N.T package is there. And the other are subject-specific books, which we often read about and talk about. So, coming to the first otorhinolaryngology book, what we say is all of us who have passed post-graduation have studied this book is Scott and Brown. So this is what we call the Bible of E.N.T or the Bible of otorhinolaryngology. This book reading is a must. But again, I tell, only reading this book won't complete your course. It will help in understanding of the subject, but many books are there which will help in gaining knowledge regarding certain specific subjects. Like in case of otology, which I am now starting with, Chambord and Glasscock's textbook is of utmost importance. One has to go thoroughly from page 1 to the last page of this textbook, and this is a very important because it has so simple details in this book has been given in the cases of otology, which is not there in Scott Brown. I can assure you that if you read through this book of Chambord and Glasscock, it will be very, very helpful. Not only in the exam, but also in the everyday, day-to-day practice, and also in the surgical skills. Now, coming to the next part, or the rhinology part, what we call rhinology, I personally studied from many textbooks, because it's a very, I found rhinology to be a bit complicated, and also same things could be done in different ways. So one must always try to know what are the different ways of doing a particular procedure, and then think of which one is easier for one, for yourself. So for that, first what I studied was Renuka Bradomam's endoscopic sinus surgery textbook, a very basic level postgraduate textbook, but very, very important. It is of utmost importance to read thoroughly through this book. Next is PJ Wormwald. PJ Wormwald's textbook, I would say there are certain concepts in PJ Wormwald's textbook which I would like to highlight that is not there in depth in other books, like the concepts of the box concept of the paranasal sinuses, the anterior ethmoids, the posterior ethmoids, which you have studied, and also the chapter especially on CSF rhinorrhea. Then we have that what we call the modified endoscopic Lothrop procedures. These are the concepts which are given in great details in P.J. Wormwald's rhinology book. Now, moving on, I also studied Kennedy's rhinology textbook, especially the part on septoplasty and septal surgeries, I would say. This part is good in Kennedy's textbook. Now, coming to laryngology. In laryngology, basic concept of we got it from Scott Brown, but certain points like the malignancy aspect, where we are dealing with malignancy of the larynx and any head neck, Stellan Maran's textbook is very, very important. Not only for larynx or head neck, even in case of rhinology, also the malignancy aspect should be studied from Stellan Maran. Though it has some conflicting views regarding certain topics like the types of modified radical neck dissections, it is in conflict with Jatin Shah's textbook, the MRND type 1, type 2, type 3 regarding the structures preserved. But leaving aside that, it is a very good textbook, especially for laryngology, laryngeal cancers, for I would say head neck malignancies, especially thyroid malignancies. It is a very, very good textbook, and you have to read in great detail in between lines to understand as well as help yourself prepare for the final examinations. Again, for larynx, I would again concentrate on Sultan Pradhan sir's textbook. This is a very, very good kind of a textbook regarding carcinoma of the larynx, which we have studied. And that's all I would. And there is a specific regarding the benign vocal cord lesions and laser surgeries kind of topic, which are often asked in postgraduate exams. I would suggest there's a book by Nupur Kapoor Nerurkar ma'am and Amitabh Roy Chaudhary sir. They are legends of the laryngology in this country, and the book on that is an excellent textbook regarding, I would say, phonosurgeries, regarding the topics like benign vocal cord lesions, how to operate on them, the mini flap, micro flap, and also regarding the video stroboscopy, regarding the points which one should study during assessment of video stroboscopy is given brilliantly in this textbook of laryngology by Nupur Kapoor Nerurkar ma'am. So this is in short, but again I say that even if you read all these books, your knowledge won't be absolutely complete, because there is no end to learning. As I always say, we go on learning even after passing MS. I have read few books out of sheer interest, like Madan Kapresar's thyroidectomy book. It's a very, very good textbook. And regarding facial nerve surgeries, there is a book by Dr. Madhuri Mehta, There's an atlas of facial nerve surgeries which one can go through. But I would say this would be better after you complete all the previous books I have mentioned. No point in going straight forward to these books because these are a little bit advanced books, and you can only understand these after you have thoroughly gone through the previous books I have told in the discussion. And also, there are a few books of Dr. Janakiram. We all know he's a great stalwart. Especially, I would say, if one has to read the Juvenile Nasopharyngeal Angiofibroma, that is a great book. Because, frankly speaking, Scott Brown, the recent 8th edition of Scott Brown, the Juvenile Angiofibroma, they have omitted the term nasopharyngeal, is not complete, I would say. Because for that, I studied Janakiram's sir's textbook on juvenile nasopharyngeal angiofibroma, and there is another book of suprasellar and parasellar lesions of the sella. These these are books which you have to read after you have completed the previous books, I would suggest. Another book I forgot to mention is Dr. Milind Kirtane's textbook of endoscopic sinus surgery. The term is a fantastic term where he has written sinuses and beyond. So there we have to study the pituitary surgeries, the endoscopic FES, the endo-DCRs. These are all basic surgeries which you have to study from there.
That's a pretty exhaustive list.
Yes,
And
absolutely.
I would like to highlight here that Dr. Mainak Maitra himself had an exemplary performance in his university exams. In this frame that we can see Dr. Mainak Maitra in, we are seeing Dr. Mainak Maitra, both the teacher as well as the surgeon. And the most stressful aspect of post-graduation perhaps is the exam, and we are talking about it. Maybe in future we can talk about other aspects of post-graduation also, like how to approach surgeries, and we've already talked about how to approach conferences. Now, with the number of books you mentioned, Dr. Moinak, I just want to know what recommendation do you have for postgraduate students who are usually working very hard throughout the day across different colleges in India. We don't really have universally applicable working hour regulations, although NMC has suggested that they should be reasonable, but what is reasonable for one is not reasonable for the other. So how do you suggest postgraduates find the time, and how much time should they find on a daily basis to read as much as possible to be ready for the exams at the end of the tenure?
Yeah, first of all, I would like to say that the current generation of postgraduate trainees, at least the trainees I am encountering now, are well efficient. They are not like me, who needed to study for long hours to get hold of an idea of the subject. So, leaving aside, I would like to share how I prepared myself for the exam over the 3 years duration. So, first was when I started my course, again, as I tell repeatedly, first 6 months, only an undergraduate textbook. I completed that. I made sure that it was done, and I will read it again before the exam. Just maybe 1 month before the exam, I will read that. But how to? I would like to highlight how to make sure that this undergraduate knowledge is there in your brain and is not washed away or buried deep in the memory. Is that I always taught undergraduate students. That's a very important part. Often you are given classes. The postgraduate residents are given classes to teach undergraduate, but I myself organized unofficial classes, not for their benefit, frankly speaking, but so that I can teach them. I can recall the topics which I had studied from the undergraduate books, and that helps in my revision process of this aspect. Now, we all know that especially the first year residency is a very hectic residency. In any government medical college, wherever he or she is pursuing post graduation, in any subject, I would say, whether be it E.N.T or anything. So, what is important, what I tried to do, I said I tried to do because I could not always meticulously follow the targets I used to set. So, whatever patients I was getting in the ward during a week, uh, suppose there is a case of a chronic otitis media, simple. Chronic otitis media is very common. We get very common things. Chronic otitis media, septoplasty, a DNS, deviated nasal septum, nasal polyposis. These I have to read when the patient got admitted. And even before the patient got operated, I have to give a read for the surgery. Yeah, what is being done? Because in first year residency, we often do not do any surgeries. We are just observers and assisting our seniors in the surgeries. So that before I could if I studied and went for the OT, the help would have been I could easily understand what my senior was doing. So that is very important, because unless you yourself understand what is being done, uh, you won't be able to perform the surgeries. And unless one assists the senior surgeon in a proper way, it becomes a reflex. Even before the surgeon asks for any instrument, you know what to you have to give. So you have to reach that level. Often juniors, what they think, I always tell my juniors also, often juniors think that assisting is nothing, you just stand beside and relax. That's not true. You have to even assist with full concentration regarding what is being done and what instruments are being used, because that will help in a number of ways. First, the pathology of the disease you have studied beforehand, what is there, what is wrong with the disease. Second is the surgery which is being done, you won't be able to understand at the first go, that I can assure you. Whoever is thinking, okay, I'll study and go, first go, you won't understand anything. But as on and on you do repeat the same protocol, I would say, you slowly start understanding why is this being done, what if this is done in the other way. You will ask, then you will start asking questions. And that's how I prepared myself, because at the end of the first year residency, I was quite accustomed with what was being done, how what is being done, so that most surgeries are given from the second year onwards, because first year is just observation and assisting kind of a job, barring a few basic emergency surgeries that we know. So that's what I followed in my first year. Is whatever patients were admitted in the ward, I tried to read the topics according to them. If any CSF rhinorrhea was admitted, if any uh, carcinoma of maxilla patient was admitted, or sinonasal mass per se, give it a brief read, because first read won't help you. First read you won't remember anything. First read is just for getting an idea what is being done, how to, I mean, uh, organize this case and understand and reach your diagnosis, how to work up on the patient of sinonasal mass. So this is how I prepared, I would say. And from next second year and third year onwards of residency, I would say it was just a revision and re-revision of the things which I did on and on.
So when you say that you studied the cases while they were getting admitted, you were reading from the books that you mentioned?
Yes, first I started reading from the in the first year residency. After the first 6 months, I started reading the big books, or the Bible, what I say, from Scott and Brown. That is very very important, and I would say that especially Shambo and Scott and Brown, these two books, when you read the first time, you will feel irritated. What is this? Because you will read pages after pages, paragraphs after paragraphs. This et al, Omuk et al, these studies were done, but at the end of the line, end of the paragraph, you will read this is of statistically insignificant. So within the 6 months, now this typical format is I found, I discussed with my other colleagues of other departments also. This is very common in postgraduate textbooks, because they deal with various studies that were done, various views that were presented in the subject. So first reading, I marked those places which were of my significance, I would say. You cannot read the entire study, and at the end of the study, you say that it is statistically insignificant. So I marked the paragraph, only part which was significant for me. So that in the long run, when I'd be going for my final revision before the exams, I knew what I had to read. Okay. And again, I told no book is complete. So, first of all, I tried to prepare my notes on and off, whatever was possible. And I would, and there are often topics you cannot prepare notes on. So what I used to do is make small points in Scott Brown or whichever book I was reading, write it down in pen in the book, or get a small sticker with further references where more to read from. So I stuck that sticker on that page, and that's where, so whenever I'm reading that, I know that there is part of another book which I have to go through. So this way, it's a cumulative effort on all aspects regarding which book to study from, and that's how I try to do it.
So just to end this topic, I want a final question that you should try to answer. So there are no fixed hours that you should devote in a day to study?
Yeah, ideally you should, yes, but the center or institution where I did my post graduation, we had basically 2 units. So every alternate day was an admission day, what we call it. So it was a very hectic situation for us. And if we are on emergency duty, it is unpredictable. If we had a cold emergency night, fine, we would have studied the topics okay. But often we had emergency nights which were very hectic, and we are also humans. We cannot go on. At least I could not study that much. So yes, but especially I would tell on the days where I did not have the emergency duties, and also when we had a cool day like a Sunday. Sundays were on rotation basis. So on that day, I tried to, I mean, complete my target which I had set for the day, for the week, I would say, and like that I prepared myself.
So, in the modern context, we have, of course, passed post graduation many years back. But in the contemporary context, we have these formative assessment tests, and we have designed curriculum where seminars keep happening on a weekly basis. Do you think that this prepared template for syllabus that is prepared by the department that comes into conflict with your own preparation style, or do you think both can be done simultaneously?
Look, if there is a, see, many things are written in NMC, and if that is followed, then fine, one can go on, because that is a properly structured course, or I would say study schedule they have made. So that will be helpful, no doubt. But again, as I say, each individual is unique in his or her own way. So what I can learn in 10 days, someone can learn in 10 hours maybe. So I think that should be tailor made with the individual specific, because each one should know how much he or she can take in during the process of studying.
Right.
Yeah, if that is in our times when we passed, there was no as such strict curriculum where we would remember, if you remember, our professor used to say that this is a professional postgraduate course, so no one will catch hold of you and take classes of you. You should study and ask us questions, and then we will give you the uh, whatever answers possible. Even we had weekly seminars, the case presentations, that's okay. But studying oneself is very, very important.
So that should go in parallel with whatever academic activities are going on in the department. Okay, so to the next topic,
Yes.
E.N.T, as you said, it has different books and no one book is complete, and it also has different question papers which have different topics for designated for each question paper. How would you advise students should prepare? Should they prepare written answers for the 10-mark questions, or should they just read from the book and know where to read just before the exam?
See, I would say it would be a combination of both, because first of all, some there are some questions where one has to prepare and extract the important points from the various textbooks and prepare notes. Whereas there are some other topics which are short, small, and you can read from any textbook. So first, what I followed, uh, which you would also agree with me, is I started preparing with you when you were my senior, so that I could learn what steps you were following. So that helped me a lot, because when I became a final year and you guys passed out, I already knew, okay, this is the thing which I should be doing, and this is the place where you guys faced difficulties. I again tell my juniors, always follow the person who is just immediate to you, so that you are also trying to achieve his task, but you have 1 year in hand. That's a very good luxury of time that you will be having. So yes, again, there is no hard fixed rule. People, if you are comfortable in making notes and you have enough time and you can make quick notes, it will be better if you can make notes for yourself. But practically speaking, it is very difficult to make notes of every topic that one is reading. It is very difficult. So what I used to do is, first of all, again in the first year, I got hold of the question bank of the various topics that were discussed, both the university question bank as well as from the DNB question bank, because often DNB questions are repeated in the way. So my first target was complete 5 years of DNB and 5 years of university. So whichever questions were there, I tried to solve them down. I usually preferred writing because I have this peculiar belief that I can remember more of my own handwriting than on the books. But that's not hard and fast. That's again I'm telling you, it's individual specific. So when I started preparing notes, I made the notes and whatever when I found topics which were mostly present in one book, you don't have to search for multiple books. Beside that question, I used to write the page number and which book. And if any extra topic was there from small points were there from other books, I used to write down at that book where the bulk of the topic was. So yes, that's how I prepared for this exam.
And that's very illuminating. So I think we have covered almost everything. So I have a few questions that my postgraduates want you to answer. So the first question is, and this is something which we have also encountered during our exams. I have encountered, I'm sure you must have also. When you go for the exam, there are 10 questions in a given question paper, and sometimes there is one question at least which you are practically completely unaware of. You're probably hearing it for the first time, reading it for the first time on the day of the exam. How do you approach a question like that, which you have no idea about?
Yeah, that's a very important question because what we learned from our seniors, don't leave the answer empty. First of all, the first thing is don't leave the answer empty. Okay. Now coming to the next part, I would say if you are well prepared, chances of this kind of thing happening is less, but not impossible. But suppose your luck doesn't favor and you get hold of a question, especially these things can happen in written advances paper, especially paper 4. That's a because you never know what's going on in different parts of the world, and whoever examiner has set that question, you catch hold of that topic, and you might know, you might not know. So suppose I'm giving one example. This year there was a question in postgraduate E.N.T exam, final exam, the recent advance about Sinuva.
Sign
What
over.
is Sinuva?
Yes.
Yes. So many of my residents, again, even I did not know what was Sinuva, frankly speaking. I came to know after this was given. So now I am telling because I am on the other side of the table right now. But what to do? So whenever you get something like the Sinuva, you think, you leave E.N.T, forget the tunnel vision, and you think what it can be. It is related to the E.N.T subject. It has something called a Sinuva because hints will be there. Unless you are absolutely unlucky, some hint will be there in the subject, in the topic, whatever is there. So it is something related to the sinus because the name has Sinuva. It has something related to the sinus. You start writing that it is a procedure for something, and the most common diseases of the sinus we all know is a sinusitis, polyposis, something like that. Unless you read Sinova, it is very difficult to say that these are mometazone coated stents or whatever blah 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 there is. But at least you can write something that is related to the paranasal sinuses. It is used in the treatment. Then you have to make up stuff like that. But if you think logically, I believe you can find a clue from these questions also. And if you the bulk of knowledge you will be having, you will be able to write something or the other. Might not be completely correct. Like I would say, one topic from my exam, there was a question asked was what were the different facial angles uh, in relation to rhinoplasty. Now there were considering the bulk of the syllabus, I had very little time to study rhinoplasty in great detail. I studied a few topics, but whatever you might say, it was my fault or my sheer bad luck. I did not have much knowledge regarding this angles used in the assessment of in the pre-op assessment of rhinoplasty. So what I did was think there what can be the possible angles of the face related to the nose. So I drew a face, made out the angles, and trust me, I had written 5 6 angles just by imagining that this could be a possibility, and out of the four were correct, and I found the four were there in the book. So that felt good on my part. So again, I'm telling is that don't get shattered when you see something you don't know. Give it some time. Come back. Come to this question at the end of the paper when you have answered all the questions that you know fluently. Then wait for some time. Give it a thought. What can be the possibilities? Think about it logically, and then you can probably uh, answer in a way which is, I would not say completely correct, but somewhat close to the correct answer.
Also, I would like to add that if you get 9 out of 10 questions that you know, then you don't need to worry much about your performance in the 10th question, because overall you are likely to do well.
Yeah.
And as you mentioned that
Yes.
if you can think logically, you'll get to the answer. If not the complete answer, close enough to do well enough in that one question.
At least get some marks.
Yes. So the key thing, as you said, is not to leave it completely blank. Now, the final question I have for you is something we did not have to face during our post graduation, but now it is mandatory for all postgraduate trainees in all subjects. This is an element known as basic course in biomedical research, where questions related to research and mostly what we used to call during MBBS preventive and social medicine questions, it features regularly.
Biostatistics.
Yeah, biostatistics. At least one question is always there in the theory paper. So, how do you approach this question?
See, but considering the recent postgraduate curriculum, it is easier for them. We had faced a lot of difficulties. We did not have formal training during this course of biostatistics. We had to read it separately before the exam, get the possible questions which can be asked. So I don't think the current generation of postgraduate residents who are appearing for the exam will have problem in this, because they are giving a foolproof two-stage examination for this biomedical research. So I don't think that would be an issue for them. But yes, these are important, and I would say another thing I would like to add here: not only the biostatistics, but some publication-related questions like impact factor of journals, like indexing of a journal, what are the levels of evidences, what are the different types of study. These should also be kept in mind. But these things, I would say, you once you will study this while preparing the thesis, it should be studied in great detail so that you know what kind of study you are doing, what methodology or statistical analysis will be followed. And again, these things can be studied before the, I would say, 2 months or before the exam, and that would suffice. Because questions are one or two, not more than that, usually what they ask.
Yes, and also I believe the BCBR test that people have to take, which is mandatory, they have to participate in an ICMR affiliated course, and most of this is covered in that. So they should try to remember that from there. So just a mild digression. This YouTube channel that we are talking on now, this came into existence because I wanted to share my MRCS journey. When I shared my MRCS journey, I was very happy to notice that my junior from college also embarked on her MRCS journey and succeeded in it. And I organized a video where she was happy to join us, and she shared her MRCS success story. Now, in the entire context of this video, I shared my MS journey, and now the other junior of the same batch is sharing his MS story here, and I am very happy to announce that both of them are extremely successful in their careers, not just as an academic in the academic field, but also in a professional aspect, which gives me great joy. So, with that out of the way, Dr. Mainak, there's one question I had forgotten to ask you in the course of this discussion. We did talk about questions that we are completely unaware of on the day of the exam, but what about the hopefully bulk of the questions that we are sure about? How much time should we devote to answering those questions, and how to write the answer in the best possible way to maximize our score in the questions that we are familiar with?
Yes, the thing is pretty, I would say, mathematical if we have to calculate regarding how to approach these questions. So, first of all, each paper comprises of 10 questions, which all of which are compulsory, and each the total time limit for the exam is 3 hours, or what we say 180 minutes. So if we divide this 180 minutes into divided by 10 questions each, we get 18 minutes per question. I would say the prime focus should be 15 minutes to each question. Absolutely stick to the time limit, 15 minutes per question, so that at the end of the paper or the end of the exam, you have a 30-minute slot for questions which you are unaware of, to think about it, to give it a thought. There are some places where you need to add on something. Suppose while writing this question you are remembering, yes, I have missed this point in that answer, you can write that down. So what is important in the time limit is absolutely stick to 15 minutes time limit. There may be questions which you know a great deal about, you can write 100 marks on it, but the full marks is only 10. Even if you get 10, you cannot miss another question. And secondly, regarding representation of answers, they should be in the form of flow diagrams, pictorial descriptions, arrows, underlining of vital points. This is of utmost importance, because if one writes the answers in a monotonous way, just pages after pages of pure paragraph writing like that, the examiners were always checking the exam scripts, answer scripts, might not read even through your entire answer. Your answering should be such that it, what would say, forces the examiner to go through what you have written. Handwriting should be properly legible. I won't say that it should be absolutely like printed material. No, it is impossible in the exam to write like that, but it should be legible. And you can make boxes, flow diagrams, arrows, make the charts, like that. It is of utmost importance. Don't go on writing just paragraphs after paragraphs like we are in the textbooks. And coming to this is why I prefer writing notes, because in the books often it is in the paragraph form. So we have to make these paragraphs into significant flow diagrams or charts which we can represent in the exam, which will allow the examiner to go through the key points, uh, which is of utmost importance. And also coming to key points, every answer has some key points or key words. We have to make sure that we don't miss them, right? So that's the thing I would say about writing and managing time in the exam.
Yes. So the important thing is not to spend too much time if you know the answer, and to keep the answer as attractive for the examiner as it is possible to be. Now, that's very well said. Now, coming to the second aspect of the university exam, we have talked at length in detail about almost every aspect of the theory exam. What about the practical exam? That is a day which is memorable for all of us. We don't forget our practical exam day during the university exam, which comprises of so many different aspects. It's not just long case and short case, which is usually we practice that throughout our tenure, but then we encounter tables like ante-mortem specimens and radiology and osteology and audiology. All of that is there. So what should be the approach for the practical exam? On the day of the exam, how do you approach it?
Yeah, on the day of the exam, first I would say you have to prepare early. As I say, for everything, you should know what you are expecting. Unless you have a real bad luck, you should be accustomed to what will be asked to you and how will you answer. So everything should be well planned out in your head. I would say the way I prepared myself, I would like to highlight on that. Uh, like case presentations. Coming to the case presentation, the long case and the two short cases, which is still now going on, although the marks division has changed a bit from this year onwards. But basics are the same. The questions they ask is more or less the same. So, what your practical exam is such that it's like a, what I would say, it's like a movie, and you will be taking part in the acting of the movie. So, more the fluent you are in your acting, the better marks you will score. This is a simple funda, I would say, for the practical exam. Now, for this smoothness of the flow in the practical exam, one thing I must tell is that regularly present cases in front of your seniors, in front of your colleagues, so that this the flow of what I would say, the speech, the presentation is smooth. This is very important, and unless you regularly present cases in front of your seniors or wherever you are, even in the hostels, whenever whatever time you get, just make someone sit in front of you and present a case. This is a very important aspect, I would say, because often candidates, I believe there are no postgraduate candidates who do not study and appear for the exam. This is not there. But the thing is that the students often fumble. They get nervous, they get tense regarding what to say, how to say, and when to say. This is very important. They don't know what to say, they don't know a simple thing how to express, and thirdly, because they don't know what and how to express, they fumble and they just cannot perform to the level they want themselves to perform. So this practice is of utmost importance because even considering my part, I was not so fluent in speaking in front of an audience but the regular case presentations, I still remember we made our consultants sit for the case presentation every morning of the week so that they would at least listen to what we were talking. So this is very important. There are institutions where there are regular case presentations happening, so everyone should take part in it. And regarding the institutions where they are not happening, I would say don't get disheartened. Create a team. You have your co-PEs. Sit with them. Each week present one case, each one of you. So that will be because if you practice over 2 years, and I would not let the first year present cases because they're already overburdened with the work, but the second and third year of residence, if they sit and practice this over 2 years, I don't think they will have any problem in presenting the cases. And more importantly, they should have a model history prepared. I always believe in this because on the exam day, we all know that patients will say many things when many of them are insignificant. They do not carry any value. So, if you have a model history prepared regarding your case, suppose a chronic otitis media, squamosal variety, you know what is the case, what you will ask. Make a structured questionnaire. You should know what you are asking to your patient, and it's like what to say, leading question. Yes, no. Because the moment you ask them, this is not your private clinic that you can listen all day. You have a stipulated time, and within that, you have to take the history and write down the entire thing, and then present it to your examiner also. So you have to be a structured case history with you, which you have kept in your mind. You have clear concept regarding it, and this I firmly believe will help in the long run because then you will be fluent with your presentation. That's all.
What about the tables regarding radiology, audiology, osteology, antemortem specimens, the smaller tables? How do you approach those?
The moment you are done with your long case and short cases, the bulk of the practical exam is gone. It's done and dusted. But the other half of the practical exam is very scoring, I would say. Uh, I think the current curriculum will be going towards the OSCE pattern, which is an all or none phenomenon. If you know, you know. If you don't, you don't. Which is in a way a good, highly scoring aspect. But if the considering what we used to have, the osteology, the tables and stuff like that, the charts, whatever we had. See, before the exam, obviously we get a few classes where we are taught regarding the tables and charts, whatever is there. Now, these not only the knowledge comes from these classes, it's about the 3 year knowledge that we have gained. Suppose you are given a pure tone audiogram, and even if you have not done the classes, or even if you have done the classes, that should not have, you should not be tense because this is something you are seeing from the first year of your residency. You are assessing it. But the thing is that you have to know how to present. You might know the answer, but you have to present in a polished way so that the examiner is very happy. There is no scope for being casual on the exam day. This is very, very important, I must say. Residents often just go, this is a PTA of this. But no, you should say this is the pure tone audiogram of this patient, of if the age is mentioned, say the age, showing this pattern. So often what happens, I see in residents, they know the answers, but they hurry to the answers. Yes, this is a case of bilateral sensory neural hearing loss. No, you should say that this is, I can see the bone conduction curve as well as the air conduction curve. There is a dip in all both the curves. So then there is no air bone gap. So these things matter. Uh, Students who can present in a very polished way, even if they know less than the people who are presenting in a hurry, will obviously get more marks.
Very rightly said. So, not to worry too much about these tables. I just want to highlight one point. That there is that audiology is a source of fear for many postgraduate residents because it does not have that many marks allocated to it. but whenever somebody is recommended a book to read, they have to read a book which is quite extensive. So, what do you think
Yes.
should be the approach to audiology?
Yes, audiology is something, as well as the part of the vestibular assessment part, which is also a part of the audiology. This is a very difficult topic, I must say. At least I found it to be very difficult and still continue to find it difficult in my day to day practice. But for the exam per se, the book we are talking about is, I believe you are also talking about the same book, is by Dr. Onivan Vishwas sir. It's a very, very lengthy book, but if you read through it at least once or twice, you get an idea. And while reading, you mark the key important parts so that before, while revising, you will study only those parts. So that will help, and it will help not only to answer your exam but also in getting some concept of the topics, because in our day-to-day practice we often get cases where if we have the concepts, we know that the audiologist did not perform the test properly, and this is very important in this era of medical legal importance. So if we are not, so we then send for a repeat of the test. But in order to understand that this patient requires a repeat test, we have to have those concepts clear, and that's what I have to say. This is but very important point you have raised, Dr. Dasgupta. That this book I also forgot to mention in the books. This should be kept in as a part of your study curriculum as well, to read those audiological parts. And there are some tests which are often asked in the theory exams also, like the SISI, ASSR, BERA. Often pure tone audiometry also comes as a long question, so be prepared for that also. But these are topics, difficult topics to understand. One usually do not understand reading it once, but over time you will gradually understand, and if possible, get a talk with the audiologist of your department wherever you are. The moment you see what is being done in a practical way, which I believe I did not, but after I completed my MS, I found talked with the audiologist, saw it in front what is being done. That helps in retention of what is being done. So that helps.
Okay, so I think we have covered almost every aspect of postgraduate university exams, both theory and practical. And thank you once again for finding time from your busy schedule. Any final thoughts that you want to share with the postgraduate students?
For these 3 years of residency, one should remember that we are not studying to pass the exam. This ultimately we have to pass to get the degree, but you have to read. Suppose there are many candidates who often reads only question papers. I have seen candidates who study only question papers and nothing else. 10 years question papers and they study that. But that should not be the thing. One should be studying for knowledge also, because this is the only time where we are learning. After we get the degree behind our name, everyone expects to know us everything from this subject. And also for the benefit of the patients also, you should be having an idea. One might not be expert in everything, but at least the basic ideas, so that we can come to the benefit of the patients as well. Temporal bone malignancy uh, usually does not come in the exam, so often neglected by quite a few students. They don't read it. While we are reading about the carcinoma larynx, it's fine. This question did not even come in my exam also, temporal bone malignancy. But I studied it out of sheer interest. Okay, this can happen. You can have a malignancy of the ear also, that to the middle ear and the external canal. Now, 2 years after I passed my exam, I got a patient who had this chronic ear discharge, elderly patient with an oral polyp. So at that time, most of us we are always burdened with chronic otitis media, safe or unsafe variety, squamosal variety, blah blah blah, whatever it is. We rarely give a thought about the other ear cases like the glomus, the otitis externa, or the malignant otitis externa, or the malignancy aspect. So if you have, because I had read, I completely agree, because I had read that topic, I had the suspicion that this might have been a malignancy. So because the CT scan, I had never seen a case of temporal bone malignancy before. I had never encountered it in my residency, nor in anywhere outside. and I'm all alone in my own clinic wherever I am seeing patients. There is no one to help me out. There is no one with whom I can discuss. So I planned for a biopsy, and the biopsy came out to be a squamous cell carcinoma. The patient had consulted many E.N.T surgeons. If you miss common things, it's a heinous crime. You cannot miss a common thing. But if one can diagnose uh, an uncommon problem, which can only be done after you have gone thoroughly through a subject, is the patient and the relatives gains trust on you. So many people could not do, you got it right. I'm not telling I did a great job. The thing which helped me was that because the other uh, consultants gave the treatment which I would have given myself, that did not work on that patient. So I thought I have to think something out of the box to get hold of this patient. So I thought of taking a biopsy. Okay, so that's what I tried to explain through this small example, that reading should not only be for passing the exam, it should also be helpful in your day-to-day practice, so that you can remember. And multiple readings is of utmost importance so that you have the retention in your head. Just mugging up and vomiting in the exam will help you pass the exam, no doubt about it, but it won't be retained enough in your brain so that you can apply it in your day-to-day practice.
Yes, that is very correctly said. So, as I had said in my video about this topic, that post graduation is not just an exam, it's also, in most likelihood, your entire career for the rest of your life. So, it's very important to treat it in that way. And thank you so much, Dr. Mainak, for joining us. This is the third time you've joined us. I would highly recommend people to check out our previous two videos. The cochlear implant video I still maintain is perhaps the best cochlear implant video on YouTube. And the second video is where he talked at length about how to approach another stressful aspect of post graduation, which is presenting in conferences. All three videos are, I believe, of as high quality as is humanly possible. So thank you once again, Dr. Mainak. And I
Thank you. It's
hope
been a
we
pleasure.
will meet again for the fourth time.
Sure.
Take care.
You too.